Okay, we're doing part 4 of this book here, Solving the Multiple Sclerosis Mystery by Hal Huggins, the dentist. This is part 4. So, before mercury amalgams were placed in 1818, multiple sclerosis did not exist. It had never been described before. It was first officially described in 1868 by Charcot. That's the famous Charcot at the Salpêtrière, the French neurologist, okay? Other sources of mercury include eating fish. Fish is terrible, okay? It's got methyl mercury in it, a bad form of mercury because it gets converted, to organic. When carbon's bound to mercury, it's called organic mercury. And methyl mercury means a methyl group bound to it. It's bad. That's totally lipid soluble, can get into your brain relatively easily. Some medications contain mercury, some lubricants, like those used for EKG testing, some Band-Aids, some contraceptives. Creams, even some vaginal lubricants. So one has to be careful and check the ingredients that those are not in there. Some fungicides will contain it. That's why it used to be in some paints to prevent mold from growing in the paint. There was a 40-year-old lady from Texas who had a root canal, got MS a few months later. She went from stumbling to walker to then being in a wheelchair. And then after he removed her root canal, a few months later, after having not ridden a horse in 5 years, she was able to rope cattle, brand them, and get them to the market. A Texas lady, 40 years old. So he had a bunch of experiences like this, and that's how he got in the business treating more and more MS patients with removal of root canals and amalgams. This is Hal Huggins here. He said he's removed amalgams in over 1,000 patients that have dental-induced multiple sclerosis. And he says, I want you to know recovery is an option. Okay, so not everybody's going to recover. Some might slow the progression of their symptoms, but it's rather extraordinary. And he's not the only one. I've seen a lot of other dentists writing about this as well. There's other potentially toxic dental chemicals. There's, aluminum in the composites sometimes. There's mercury, copper, nickel, root canal toxins. All of these things can cause membrane dysfunction. A lot of these patients have chronic fatigue, especially with the copper-mercury amalgams, because those let out mercury more rapidly. And mercury is a mitochondrial inhibitor, so that can decrease energy. Other symptoms from amalgams and root canals can include unexplained anxiety, impulsiveness, irritability, depression, sleeping problems, suicidal thoughts. They had a whole bunch of patients who had written a suicide note, and then they teared it up after they had their amalgams and their root canals removed. So if you have somebody in your family who's feeling that way, you should get this checked out. Maybe you can help them. Tachycardia, cramping at night, so like restless legs. Fast heartbeat tachycardia, which makes me think it might increase the risk of atrial fibrillation. Certainly if you have a mitochondrial inhibitor like mercury, that could potentially. And those anaerobic bacterial toxins from root canal, those can also inhibit mitochondrial function, so they could potentially contribute to immune function suppression and to atrial fibrillation. Multiple sclerosis is 2 times more common in women than in men. There's a couple proposed reasons for that. One might be they might have a more hyperactive immune system. Another one, they get 80% of autoimmune diseases. It also might be, he thinks, well, I'm not going to get into all those theories, but it's just more common in women. 12 million Bantus in Africa, not one case of MS. And I showed those slides already with the global distribution. Sweating is a good way to get rid of mercury and other heavy metals. Yeah, so that's why I always wear, typically nowadays, even in the hot summer, a t-shirt under a sweatshirt because I want to sweat more. Why do northern areas predominate in their distribution of MS? There's more white people. I don't think so because they've got a lot of white people down south and they get a lot less MS as well. So it's not that. Plus swank look, it wasn't a latitude thing. I'm just throwing these arguments out because you're going to hear them. Less vitamin D. I don't think so either, again, because in Norway there was a center of the place that got MS, not the periphery. Northerners eat more meat and dairy, that's true, and that'll also contribute to leaky gut, and that matches the theory of Dr. Swank and McDougall. And patients responded very well to a low sat-fat diet, so I think that's another big reason to believe in that, and he had good long-term follow-up results. Southern populations eat more plant foods because it's warmer. You can grow plant foods all year round. In a winter place with snow and everything, you got to eat animal foods more often and dairy. Where you eat more plant foods, you'll have less leaky gut. Third world populations, they're going to have less dentists. They're going to have less times when people are placing amalgams and doing root canals. They'll also have less cavities if they're eating more plant foods. Number 7, people sweat less in northern climates, which also gets rid of mercury. And number 8, I talked about Amalgam seldom placed in equatorial areas. Okay. Average lifespan after multiple sclerosis is diagnosed in the USA is about 21 years, but much of that is quite often debilitated, and a lot of people die faster than that. I've seen a lot of MS patients, some where it's pretty mild, but I see tons of disaster MS patients with tons of lesions in their head. It's pretty common that I'll count 50 lesions in their brains, you know. Typical report is, bilateral periventricular lesions, subcortical lesions, supratentorial lesions, infratentorial lesions. You look at the flare sequence, compare it with the old one that's called the flare-to-flare compare. I've seen a ton of them, okay? And they also get a lot of cervical spinal cord lesions. They get some thoracic spinal cord lesions. It's not good. Let's see. He said, I've only heard of 2 cases of multiple sclerosis thought due to bleaching of teeth, but do not do that. Any chemical you put on the surface of a tooth can be drawn into the pulp chamber and damage or kill the living part of the tooth. This can lead to dead teeth and cavitations. Okay, I've also heard not good to use those whiteners in toothpaste because they'll cause more mercury to come out of amalgams. I already talked about, don't brush over the amalgam molar surfaces either. You'll remove the corrosion and you'll stir up more mercury to come out. I currently just brush with a toothbrush with no toothpaste, nothing on it, because anything that's on there can get into your teeth through those dentine tubules, so I don't want that. Okay, a little more Hal Huggins here. This is, again, part 4. I'm going to just do this page here. We'll call it a day after this. Let's see. The average death age for dentists in Missouri is 52 years of age, and it's not that stressful a state. A lot of dentists are kind of crazy because they got mercury poisoning themselves. Every silver filling contains about 1 gram of mercury. These are the page numbers in the book, the page numbers from this book, of course, Solving the Multiple Sclerosis Mystery. Increase mercury release with chewing gum, chewing anything, especially hard foods, grinding teeth, brushing over tops of amalgam, cell phone next to teeth, better use speakerphone, having an MRI, but that's only a once in a while thing. Hot liquids in the mouth, that's a bad idea. You can drink your coffee cooled off. If you're going to drink it, you don't even need to drink it at all. Dental cleanings, remove corrosion off amalgams, that's bad. Mercury vapor is increased a lot by that. One lady kept detailed records, and she noticed that every time she went for a dental's cleaning, she'd have a relapse of her MS pretty soon after that, because they're rubbing fluoride on top, and fluoride stirs up more amalgam mercury, so you don't want to do that. Since 1976, the amalgams got more copper. Most amalgams after 1976 have been copper type, and they release 50 times more mercury vapor. Huggins says he was on an hour-long TV show, and they invited people to call in and tell what disease they got from their dental procedures, like a root canal, and all 8 phones had operators busy for an entire hour, and by far the most common problem related to root canals that happened that people associated with it was multiple sclerosis. A root canal procedure cannot sterilize the tooth because there are tiny tubules running through the tooth out to the periodontal ligament. There's no oxygen in these tubules. And again, we talked about the aerobic bacteria crawl into the tubules and they get converted to anaerobic bacteria, and then they release anaerobic type toxins. The PDL connects the tooth to the jawbone. That's the periodontal ligament. When a tooth is removed or extracted, you must remove the periodontal ligament. If you don't do that, you're much higher risk to have a post-operative infection and develop a little cavity in the bone called a cavitation. And bad bacteria will have a tendency to proliferate in there and release toxins into your body. A lot of people can handle these things pretty well while they're young, got a good immune system, but the older they get, the more likely that they're going to be vulnerable to having a problem. The fish that have the highest amounts of mercury are like tuna and salmon. And those are the most common ones that people eat. So it's a disaster. If you eat enough fish, you can get multiple sclerosis just from fish, even if you don't have any amalgams. You can also get a lot of stupidity, cognitive decline, like the Jane Hightower book. She called it fish fog. Okay. What about my teeth? Okay. I haven't had my teeth cleaned in over, this is Huggins. This is Huggins himself. He says he has not had a dental cleaning in over 40 years. He brushes with salt and soda, and he flosses about once every week. He says, it only takes 3 minutes a day because my body's chemistry is in balance, so this makes tooth maintenance so no big a deal. There's a little truth to what he's saying. He's basically saying the healthier you are, the less likely you'll have a tooth problem. So I'll buy that. I still I floss every night because your saliva drops at night, so you want to have those teeth cleaned out before you go to bed. And don't take any medicines with anticholinergic side effects that drop your saliva production. I told you my routine. I rinse my teeth off with a water pick, and I swish and rinse them out that way. Then I floss. Then I use a blank toothbrush and rinse my mouth with reverse osmosis water, and I'm good with that. I like that. I've been happy with that. Let's see. Patrick Storterbrecker did a lot of research showing a connection between dental fillings, infections, and multiple sclerosis and other neurological problems. Same as Hal Huggins, he got tons of resistance from the medical and dental professions. They don't like it when somebody comes along and figures out something new. I'm telling you, this is weird medicine. See, the average person is so sort of brainwashed into conformity and stupidity, they think the medical system's there to help them. It is not. It's there to make money. And it doesn't like it when some upstart comes along and figures out a better way to treat something that doesn't make them money. Then they're annoyed because they might lose money and they might also have the hassle of having to learn something new. The patients are just lowlife scum, peasants, They really don't care about them. It's rather bizarre, but imagine, it's run by billionaires. Billionaire perverts run most big institutions. You think they care about some prole that walks in the door? Okay, Storterbrecker. His basic concept is that toxins can bypass the blood-brain barrier by veins and by nerves, retrograde axonal transport, and they can alter brain function. Other researchers have confirmed his findings. To be able to treat a neurologic disorder, we preferably need to know its cause. Yeah, then you know what to avoid. Multiple sclerosis plaques occur around a vein, the valvulus veins with bidirectional flow from the jawbone to the brain. He injected contrast into these veins in the maxilla, the bone of the upper jaw, and he showed that it opacified the veins of the brain. Mercury can also travel along the nerves and retroaxonal transport. Mercury and bacterial toxins from periapical osteitis, inflammation around root canal or cavitations, that can cross the blood-brain barrier. It can cause inflammation next to the walls of the veins in the brain, like an MS lesion. It can also cause these same veins communicate around the eye, and they think this is associated with causing optic neuritis. These patients have a high incidence of having dental inflammation, about 88% of them per Storterbrecker. The primary pathologic lesion of multiple sclerosis is perivenous inflammation, okay? Meaning that it's primarily an inflammation problem first, and the demyelination only happens secondarily. So this is the reason for all this stuff, is to explain how they can say it's coming from an infection in the tooth rather than from the old traditional autoimmune antibody. And I actually think it's both. I think it's more often what Swank and McDougall are saying, but I think this is a really important thing. And you want to know this so you don't give up on people. You can help a lot of people. Okay, well, that's it for part 4 of solving the multiple sclerosis mystery. I still got a couple parts to go.